All right, you're live.
Good morning, everyone. This is Angie McDonald. I'm the state school nurse consultant with the Kentucky Department of Education. I'm coming to you today from my front porch, so just ignore the sounds of the cars coming by, but I'm taking advantage of this wonderful sunshine we're having. I'm here today to talk to you about the new guidance, Healthy at School, that was released on the 24th of June in conjunction with the Kentucky Department of Public Health and the Kentucky Department of Education. This has been a very long awaited document that I know you all have been waiting for quite some time. Um, a lot of blood, sweat, and tears have gone into the development of this document, and we have spent many hours at the table trying to advocate what's best for students, what's realistic to be carried out in schools, what things will take less burden off the school nurses. So we know it's not a perfect plan, and we know it's going to be a hard plan to implement, but we're a very resilient bunch, we school nurses are, and we've dealt with a lot of other illnesses and outbreaks over the years, and I know that we can handle this as well. I want to just do a couple housekeeping things today. That this broadcast is different than what we've traditionally done. This is a webcast versus a Teams meeting. With this being a webcast, you will not be able to unmute and speak and ask questions. You'll be able to hear the presenters, but you can't speak to us. However, there is a question and answer box on your screen on the right hand corner, and then you can type in any questions that you have there, and they will come directly to us and we can address those. I have some questions that have already been submitted through our Google form, and we'll get to those, but we've got some things we would like to go over first. We have Dr. Emily Meserly from the Kentucky Department of Public Health will be joining us a little later in the call, and she will be able to answer a lot of your specific questions, public health related, on the guidance piece, and I'll do the best I do my part on the educational portion of it. So we'll get started. This webcast will be recorded, and once it's made ADA compliant, it will be posted on our Kentucky KDE School Health Services COVID-19 webpage, and you'll be able to view that later if you have other people in your district that would like to watch it, maybe are on vacation. I know this is a big week for vacations. That will be archived there for future review. All right, I want to do little housekeeping, more housekeeping. Just want to remind everybody about the Kentucky School Nurse Association's virtual conference. It's going to be held on Monday, July 14th, and then on Tuesday, July 22nd. It is, the forms came out online on the listserv a week or two ago to register. There will be a new diabetes training program that will be unveiled on the 14th. So I encourage people who normally maybe don't do the 2-day session to do so this year. It has been totally revamped. New material has been added. The new recommendations and guidelines are all on there. And this has been a huge undertaking. We've spent the past 18 months with the Kentucky Department of Public Health, the University of Kentucky, the University of Louisville, Cincinnati Children's Hospital, and Vanderbilt Children's Hospital have all worked together to develop this training, this uniform training for school personnel. And there will be a nursing component as well, where you can receive CEUs for doing that, and that'll all be revealed, and information shall be available on July 4th. Our medication administration training program, I've been getting a lot of questions about that. There have been no changes to the content for the 2021 school year. The ELA certificate has been updated and goes live, is valid starting today. If you would like to request that certificate, you can email Samantha Engstrom. It's samantha.engstrom, ENGSTROM, at education.ky.gov, and she will email that to you via one per distance, one per district. Please, we don't need everybody emailing at once to bombard Sam. So if you can do that, then she'll get that out to you. All right. First slide, please, Josh. Okay. If districts are not documenting in Infinite Campus, this year is going to be the most important year, I think, in the history in our lifetime as school nurses, the importance of good quality documentation. So if you are not currently documenting in Infinite Campus, we really encourage you to do so. It's not a mandated thing. We don't want you to have to be double documenting and that sort of thing, but please work with, if you're contracting with the health department or FQHC and you're not using Campus, please reach out to them to see if you can do so. We're happy to work with them to help modify the best we can so you can satisfy your documentation needs for both areas, because tracking your COVID students is going to be very important this year for contact tracing purposes. Infinite Campus has already started developing some new COVID type things for health that have not rolled out there yet. But on my screenshot, you can see a new waiver for a place to do daily health checks that can be recorded, which you can record them very quickly. It's just going to be a matter of check boxes, type in a temperature, that sort of thing. So this will be a handy thing to use when you're documenting students or staff members that have had a positive health screen. We're also in the process of developing a way to track students who have waivers from wearing masks. That will be an important thing to let contact tracers know if there's a positive case, if there's a student who has a health exemption that prevents them from wearing a mask. They need to know that because they're considered a high risk student for doing so. So once we hope to have all of that finalized by Campus and to be able to give you a finalized update on that at the Kentucky School Nurse Conference on the 22nd. And we'll go over how to document all that correctly in Campus and how to find it and what reports might be available by then. Okay, next slide, Josh. All right. My computer is not playing along here with me. Okay. And we'll go back to talking about the mask waivers since I brought it up and it's on my mind. That our Healthy at School guidance has said that students kindergarten and above should wear a mask anytime they're on a school bus or anytime they are in a classroom closer than 6 feet apart or anytime anyone is moving. So unless they have a medical or other type of waiver, that would be for students with asthma, employees with COPD, heart conditions, kids with autism or severe sensory needs. There may be some that have behavior type issues that a mask would be very traumatic for them to wear. And so there have been provisions made for them to not have to wear these face coverings. However, we do we don't want every mama will just write a note and say Johnny can't wear a mask. So we are asking that parents either get a note from their medical provider as to why they cannot wear a mask. Johnny has severe asthma, blah blah blah. And it could be something simple as written on a prescription pad. It doesn't have to be a fancy form or anything like that. Or if the ARC team decides that that is what's best for that student, that can be a decision of the ARC. So you can use either one of those and possibly both. If mom gets a doctor's note, you can present that at the IEP meeting. And it's very important that special ed staff share that information with the school nurse, and the school nurse shares that information with special ed staff, and as well as building administrators, because we don't want students being called down, so to speak, for not having their mask on when they have a waiver from wearing it. Right. Also, speaking of waivers, our Interim Education Commissioner, Kevin Brown, and Lieutenant Governor Jacqueline Coleman have signed a waiver memorandum for giving school districts more flexibility for the upcoming school year. Part of that is there will be unlimited NTI days that can be granted instead of the 10 days. There's also flexibility on doing both in-person and virtual learning. You can do hybrid models, which we have not done in the past. There's been some a little relaxing, so to say, on home hospital. So there's we'll be able to talk about this a little more when we get into it, but we'll talk about with contact tracing who needs to go on maybe virtual learning versus home hospital and whatnot. That's been provided. There's also been waivers in regards to funding and what funding models that they can use from previous years, so they're not going to lose fundings for this upcoming school year. So that's pretty exciting. And we're also collecting other things that have popped up that we may need to get waivers on. And we're keeping a list of those, and our KDE leadership team are evaluating those, and then we'll share those with Lieutenant Governor Coleman, who is our education secretary for the state, and possibly see about getting further waivers as needed. Another question that we have gotten frequently is if the health screening exams have been waived for this upcoming school year, and they have not. Immunizations, physicals, vision, and dental are still required for the upcoming school year. However, we know that there's going to be a lot of kids that haven't had it because we've been in quarantine, or parents maybe still aren't comfortable taking their kids into a crowded doctor's office. So we know there's going to be a lot of kids that don't have it coming back, and we don't encourage you to exclude them. We want you to get them enrolled in school, either virtual or face-to-face, and just work with those families to get those required exams and screenings. There's not going to be any penalty from KDE for screenings or exams that were turned in late past our parameters. So, don't worry that there's going to be any repercussions from us, because we know this may be a long ride, and this school year is going to be very different from anything we've ever dealt with in the past. So we want to make sure that you have as least amount of worries as possible. Okay. Let's see. I'm going here through my notes because I don't want to make sure I'm not. And our waiver also did some flexibility with school calendars. So they've been able to tweak it to where they can have less days, but more time, and that sort of thing. So they've been able to do different calendars. So that's another option that will be of benefit to school districts for the upcoming year. All right. So now I'm going to start talking on our best practice and guidance document, or Healthy at Schools, that was released on the 24th. This document, we tried to make it as user-friendly as possible and to break it down into safety expectations, or in other words, what you must do versus best practices, or what we recommend you do for the school year. And it's been broken down into different buckets, which include social distancing, cloths, face coverings, school health policies, and PPE, criteria for screening and school exclusion, sanitation and environmental factors, contact tracing, and that's it. There's also going to be a companion piece that we will be releasing next Tuesday, July 6th, that's called Workplace Health and Safety, and it goes a little more in depth than this document does. We've tried to answer as many questions as we can for that have come in from districts and school nurses that we thought may be of interest. So they is addressed in that document. And once that is rolled out, it will be announced on the listserv. There'll be press releases through KDE, and it will be posted on our school health COVID page as well as the KDE COVID page. So far, we have about 10 or 12 supplementary guidance pieces that have already been posted from KDE that go everything from NTI to transportation to facilities, hybrid learning, that sort of thing. So I encourage you to go to our webpage and glance through those, because some of them actually have little pearls that a school nurse might want to know, especially transportation and facilities, because they address social distancing. Facilities has a chart where, based on your square footage, that tells you how many the recommended students per classroom would be. There's the facilities has also on cleaning, what approved cleaners can be used, recommended time frame for cleaning, how often, etc. So those are already on our webpage at KDE's COVID-19, and I encourage you to check those out. So Josh, if you don't care to pull up the Healthy at Schools document. Okay. And you can just roll down to page 2. And we'll just keep on going till we'll keep going through there. Well, I think we've already talked about this. This kind of talks about the timeline of all the things the governor has put into place with our state COVID plan. We realize that this is a public health emergency. This is a worldwide pandemic. Everyone's kind of in the same boat. We're all kind of fighting the same issues, but yet, different areas may have more cases than others, and may need to be a little more heightened on the response than some other counties maybe who only have one case. The big thing that seems to be the biggest hurdle is the necessity of wearing masks. And unfortunately, this has become a very political issue. And in order to get kids to do it, we're going to need parents to model it and be good role models, encourage it as much as possible. KDE is reaching out to some local state celebrities to possibly do some PSA, some little videos on how cool it is to wear a mask. I mean, how important it is to wear a mask. You know, they're already showing the UK football team. You know, we see them on the news. They're moving in and they're doing workouts, and you know, they've got very stringent parameters that they're following. They're wearing their masks. They're going in and you know, leaving their shoes and gear in the training facility and not wearing them out. And you know, so if we can get more kids to see that and see that it's okay, I think the easier it's going to be for all of us. Okay, you can roll down. Okay, as we talked about, this has been broken down into safety expectations, or what you must do, versed on best practices, or what we recommend you do. Now, we're not going to be the mask police, and the Department of Public Health is not going to be the mask police. And, you know, we're not going to come in there and write anybody up, you know, if Johnny doesn't have his mask on, or the two little preschoolers are 2 feet apart versus 6 feet apart. We're being realistic here, and all we ask is you do the best that you can and make a good faith effort. We're human. There's lots of variables that get thrown in there. We're dealing with children who are unpredictable. So don't feel like that we're going to come down on you, because we're not. We know how hard this is. We know this is a heavy lift. So it's very important that we all lift each other up and support each other through this. Use nurses in your surrounding area as a resource. Many times as a school nurse have I called other nurse friends and said, well, what do you think about this? Or this is what's going on here. Are you seeing that there? And use each other as resources, because school nurses feel alone a lot of the times because we don't have a doctor there to talk to. We just have each other. So use each other, and use me, of course, or Samantha, if you're having issues about Infinite Campus, or you're frustrated about Infinite Campus, whatever, just, you know, reach out to us. That's what we're here for. So let's roll on down to social distancing. Okay, you can go a little bit farther. Okay, so the big thing is to try our best, you say, to maximize space between students as possible. We've encouraged transportation to stagger times, about possibly bringing in younger students in at a different time than high school kids, so they're not on the bus together, because preschool and kindergarten are not required to wear a mask versus older students who are. Any type of, you know, avoiding a crowd, for instance, everybody piled up shoulder to shoulder in the cafeteria first thing in the morning waiting to be dismissed to go to their classrooms. You know, those things can't happen now. So everyone's going to need to start thinking of different ways to for students to enter school, that it's not going to cause as much congestion as possible. You may need more than one door for, or we've suggested with buses to only unload one bus at a time. And there will be a staff member at the bus doing temperature checks as students get off the bus. If they don't have a fever, they'll proceed on to class or wherever they're supposed to go to. If they do have a fever, then they will be sent to the school nurse for further evaluation, to be checked out. As far as the car rider lines, we are asking that, you know, you have multiple people doing car riders, and before the kid gets out of that car, you check that temperature. If they have a fever, then they're back in the car and on their way. If for some reason, they walk to school or whatnot, they would be screened at the door. And if there was no parent with them to take them home, they would go to the school nurse to be screened, and then you would proceed with your normal protocol for what you would do for fevers. Question about preschool, kindergarten not required to wear masks. Are they required to social distance? Yes, that is as best as you can. They are asking that preschool and kindergarten try their best to social distance as much as possible. I had a CDC doctor explain it, and it made such perfect sense that everything that we do to protect ourselves is like a piece of Swiss cheese. Hand washing is your first piece, for instance. Well, there's holes in there, so hand washing isn't going to protect you from everything, so stuff's going to get through that first hole. You add another slice of cheese on top, which could be social distancing, 6 feet apart. That's an added layer, and that's going to make your barrier, your holes, a little smaller and let less germs through. Wearing masks would be an additional layer, and so eventually you get enough slices of Swiss cheese in place, you're still going to have a good barrier to protect you from the germs. It's just going to be lessened. For instance, if you can crack windows a little bit in your classroom and have air circulating, that is another mitigating factor that you could do. So you do the best you can with the little ones. We know it's going to be hard. Stations and that sort of thing will have to be adjusted. You may have to have more so they can be spread out, or you may have to eliminate rotating through little stations at all. I've encouraged people to, let those kids spread them out as much as you can, as often as you can, even if they're in a classroom where they can't be 6 feet apart and they're wearing a mask. Give them every opportunity to be able to take that mask down, because we all know masks are hot, and they're going to be a lot more willing to wear one if they know they're going to get breaks frequently. Get them outside as much as you can. Spread out all over the classroom and do, individual reading. If everybody's spread out, let them take their mask down. But the big rule is if you move, you mask. So if somebody's up passing papers or constantly going to the trash can or whatnot, then the kids are going to have to put their mask up. So, you may have to get a little ingenuitive about taping a Walmart bag to everybody's desk for their own individual trash can, so everybody's constantly going to the trash can, to minimize movement, so you can keep your masks off longer. So it just comes into being creative and flexible, which I know our teachers and nurses are. So these are things that you guys do already. We're asking that you position all your desks where they're facing the same way, so that way they're not facing each other and breathing into each other's personal space. Markings on the floor like we see at Walmart and everywhere else that shows your 6 feet spacing. I know our custodians are not going to like it because they love their sparkly polished floors, but we're just going to have to do what we're going to do. Be a little, you're going to have to come up with a plan when you do class wide going to the bathroom. You may want to encourage kids using every other urinal or using stalls. We've just got to spread those kids out as much as possible. Okay, Josh, next page. Yeah, and it kind of goes along with it. You want to try to reduce the amount of contacts that a student has, if possible. Ideally, in a elementary school, you would do self-contained classrooms, and that may not be realistic, and we know that. But if you can limit the amount of students that are together during the day, it's time. If we do have a suspected COVID, that's fewer students or staff that would have to possibly go into quarantine for 14 days. There is going to be guidance released soon on choir and gym and art and that sort of thing on how to do those and minimize exposure, especially you're seeing singing, because we know it's carried through air droplets. And the louder you sing, the farther it's going to go. And the same thing with playing instruments. So we have guidance coming out within the next 1 to 2 weeks on how to handle that, and that will be on our webpage as well. We're really encouraging not to do field trips and assemblies or large group activities for now, like fall festivals and whatnot. We've really got to adhere to the governor's guidance on group gatherings, and we're seeing, spikes in cases all over the country. So we have to be vigilant about protecting our kids, limiting non-essential visitors to the school. That does not include any mental health workers or physical therapy, OT, any of that comes in to see our students. They are still allowed to come as usual. They'll just need to do the health screening like staff and students will be asked to do. And but no, we're not going to deny services to any of our students. If there's a positive case in a classroom, will the whole class have to be in quarantine for 14 days? That is your the health department contact tracer will make that ultimate decision, but more than likely, they probably will. If it's one if it was a preschool or little ones, it's not, then more than likely they will. And what they would do is put them on virtual. They can do virtual learning during that time. So they can still go to school or whatnot and then when they're released by the contact tracer as being cleared, and the school gets notification that they've been cleared, then they can come back to the classroom for instruction. So we anticipate that you're going to have students and staff that's going to be kind of coming in and out from quarantine to do virtual or home hospital if needed. Now, we're not recommending home hospital for any student that is not positive. If they are just in quarantine, they will be offered a virtual option or packets if they don't have ability to do a virtual option. And only if they're positive would they go on home hospital. Okay, we're asking that we reduce congestion in common areas like the nurse's office, the guidance office, the front office, anything like that. And we've had lots of questions on how's the best way to do that, because how do we prevent our students who may be just coming for a finger stick or their daily meds, how do we keep them from getting unnecessarily exposed to someone who's possibly exhibiting COVID symptoms? I've been addressing this at our superintendent's webcasts for weeks now, asking superintendents to think about a separate room for isolation for your students. And you may want to even think about a different area for your routine things to go to. For instance, you may have an unlicensed trained staff member that gives all the daily meds, so they're not in the nurse's office, or your diabetic person who's trained in diabetes care. Maybe your diabetic students go to them, so they're not necessarily getting exposed in the nurse's office. We've stressed the importance that isolation area needs to be staffed. Kids have to be supervised until they're picked up. So this isn't a new concept to them, and we've asked them to start thinking about it. So if you've not got a plan yet, talk with your building administrator and your superintendent if need be, and say, okay, how are we going to handle this? Because I can't stay in the nurse's office and see kids, yet there might be 10 kids waiting to go home in the isolation room. So it may be whether you use some of your ESSER money and possibly get an aide. You may have instructional assistant that has a planning or has a planning time that could possibly cover that area if needed. But we just can't leave kids, especially sick kids, alone in a room waiting to be picked up. We've talked a little bit about transportation document. We'll go a little bit in this, but we've asked that buses can be full capacity if all students wear a mask. Students, the only exceptions, of course, would be students with a waiver or disability or your preschool kindergarten. Those students need to sit near the front. And the older students, if possible and the weather permits, we're hoping they can crack their window a little bit to get some ventilation. We're asking that they board from back to front if at all possible. Our students with health conditions need to sit near the front. Our little ones that need an extra eye on them need to sit near the front, of course. And then we're asking bus drivers to keep that front seat empty. This is probably going to be your isolation seat. For instance, if you're at the bus stop and a student gets on the bus and he is sick and there's no parent there to send them back, then we have a legal obligation to take them to school. So you would seat them on the front seat and get them off the bus first, and they will get, then you would follow your district protocol on caring for a sick student who is on the bus. Students need, and it's going to be some education for these kids. They're going to have to learn that they can't get up out of their seat until it's their time to do so. It's not like on the airplane where the plane stops and everybody stands up and tries to pack into the aisle. Those days are gone. We can't do that anymore. So there's going to be definitely some instruction done with our students as far as bus loading and unloading. Okay, we'll go on down, Josh. We've already talked about social distancing, smaller class sizes if possible. We'll just keep going. Okay, we've talked a lot about masks. There are some links in this document on face coverings. There's downloads that you can print off. The supplemental piece that comes out next week on the 6th has lots of information on resources for training parents and staff that are free that nurses can use for educating parents on putting on and off masks, the importance of masks, gloves on and off, what's the signs and symptoms of COVID, when should you keep your children at home, those sort of things. So I'll scroll down a little bit because we've already talked about masks, that everybody has to wear a mask unless you're under kindergarten or have a underlying condition. We're going to talk about temps here in just a second. We'll just keep going. Nebulizers and inhalers. There is some debate about, with this being aerosolized, to try to avoid doing nebulizer treatments in the school setting if at all possible. We realize that won't be possible for every student, that's just going to be the way it is. So we just ask that you take extra precautions, that you're wearing full PPE, including a face shield, to protect yourself as much as possible, and do it in a room not with other students. Ventilate that room if possible. You just do the best you can and wipe things down afterwards. Even when using an inhaler, helping a student administer an inhaler, you still should wear your full PPE. If a student is self-administering, they will not need to wear PPE because it's their own aerosol that they would be breathing. How many students in isolation room? There's really no set number. Ideally, you would sit them 6 feet apart, and you would try to get a mask on them, even if they're little, and if they would wear a mask, I would probably try to get them to wear one. But you just do the best you can in the situation that you have. So, let that answer that question. Okay. So, all right, then we'll keep going on down. We've talked about the PPE. Oh, yeah, telephone triage. It's going to be more important than ever that our teachers try to screen the kids a little more when sending them to the nurse. I know they're all going to be scared to death, and they're going to consider every kid that has COVID. And the first time somebody sneezes, they're going to want them to go home. And so I encourage you to maybe possibly do a little checklist that they could assess the student a little bit before they send them to the nurse, and even call the nurse's office and see before you send that child, because you don't want to send them if there's already a sick child in there. They may need to keep them in the classroom for 2 or 3 minutes till you can see that student. So coming up with your plan for sending students to the nurse will be very important, and to communicate that to your staff and make them aware. And they may need weekly reminders. You know, you may need to update them at staff meetings, because everybody's going to be nervous and everybody's going to be a little on edge, and that's normal. That's normal. Okay, we're going to go on down. Okay, screening and school exclusion. Awesome. Okay, here's the big question. We really need, like I said, we need to talk to, do we need to make the ISOLUMEs negative flow rooms? If you can, that would be wonderful, but we realize most people aren't going to be able to. This all falls under, you do the best you can. Crack the windows if at all possible. That room's going to need frequent cleaning. You know, as soon as you get that group of students out, you're going to need to wipe everything down. There's going to be thorough cleaning need to be done every evening, just like for the nurse's office. So, you know, this is another one that you do the best you can. All right. This falls onto a lot of parent education on, and we have in this plan, there's lots of cute little graphics and stuff that you can print out and use for things to send to parents on when to not send your child to school, what are the symptoms you should look for. And we have come up with the fact that if a parent signs an attestation, I think I pronounced it correctly, or basically they'll sign a thing at the beginning of the school year that you will not knowingly send your child to school if they have this, and this symptom. Okay. That will be signed at the first of the year with all your back to school stuff. They can go on and put the student on you can put the student on the bus without doing a full health screening. Districts have the option to either check the temperature at the bus or when they arrive to school property. So most school districts don't have bus monitors for every bus. So in that case, that parent has signed a sworn statement that they're not knowingly going to put their child on the bus with sick or with a fever, which we know will happen, but the district is covered. You will, when they get off the bus or get out of the car rider line or whatnot, there should be staff there taking temperatures. You will not need to ask them that full health screening. You know, have you been exposed? Do you have a cough? Blah, blah, blah. Because one thing, if you ask Johnny if he has a cough, a fever, or, you know, can't taste, he's going to figure out pretty quickly if he says yes, then he gets to go home. So, so we're not, you know, we're not giving them that option. You will not need to record these daily temps or screenings if they are negative. The only time that you will need to document, and I'll repeat this, the only time you'll need to document that there is a positive screening with that they have a fever. Or if they get off the bus and they're having symptoms, of course, they've, hacking cough, whatnot. That's when you would document that into Infinite Campus. That will save a lot of extra work for school nurses and other district personnel who's going to be doing that. It's going to take too much time to ask every student those questions and fill out a form every time they're getting off the bus. So you may want to make a little some little template things that the staff member would write down the temperature if they had a fever when you send them to the nurse from the bus. But other than that, you should not have to document. Do we have a copy of this paper? Okay. Face shields acceptable for teachers. I'm going to let Dr. Meserly from Public Health, when she gets on, address that. There's been some discussion on if it was acceptable if they could not wear a mask, but I will let her field that question once she gets on the line. Okay, we'll go on down. Going to the next page. Okay, we're coming down to our exclusion criteria. Students or staff should stay home or be sent home if they have any of the following: temperature greater than 100.4, cough, vomiting, diarrhea, new rash, and of course exposure to a case during a 48-hour period of onset of symptoms. We encourage you to post signs on people not to enter. Like I said, this cute little graphic here with the little notepad with a checkbox is awesome. I would print those suckers out and blow them up, laminate them, and hang them up. We do have a poster that is being released. The governor showed it on his press conference. It's kind of more for younger students, but we will be getting one for older students and parents on when to keep their students home. And we are working with Jefferson County Schools linguistics department, and they are translating that into the top 5 most spoken languages in Kentucky. So you will able to print those out and hang them up and distribute those to your families that may not speak English. The parent attestation, that there will be a sample one of those in our document that comes out on July 6th, our companion piece. So look for that next week, and that'll be out. And they're working now with Infinite Campus, to make that part of one of the documents for online registration for next year. So that will be one less piece of paper you all will have to deal with. Isolation criteria. Of course, anyone that's having symptoms need to go to isolation room to wait to be picked up. You will need to follow your district policy. If you can't get a hold of anybody, you cannot send a student home on a bus with these symptoms. That's one of the absolutely no-nos from the Department of Public Health. We can't knowingly expose an entire bus of students to possibly to COVID-19, because then all those students would possibly need to go into isolation. Return to school policy. When the local health department or the student's provider gives them clearance, they'll contact the parent and the school, and we'll let them know when they can return. If you want to go on down. They're discussing whether or not we're going to have a code for known cases like we did with flu or whatnot. That's still being determined from campus, and we'll know more by KSNA at our Infinite Campus presentation. We really want to, of course, emphasize proper hand washing, frequent hand washing, use of hand sanitizer, healthy nutrition and PE, and really utilize your specialist teachers to try to teach some of these for me. They did these a lot for me when I was an elementary school nurse. That my librarian was wonderful about doing these kind of things. The art teacher would include it in, her art lessons. So, there's a lot of things that you can do to cover this and keep you available to see 6 students. So we'll go on down. I'm not going to read over this line for line because you all have the document. Because there will need to be extra training for bus drivers. There is a transportation training going on this afternoon at 1 o'clock where their guidance document is being released and will be discussed with them. And you may want to review that as well because it's going to talk about wearing masks on bus and cleaning and that sort of thing. We'll go on down. Sanitation and environmental stuff, because we have a guidance piece that was released. It was either this week or last week. That's on the KDE webpage, and that's it discusses in great detail what cleaning supplies can be used, how often they should be used. Of course, you want to clean high touch areas frequently. Simple things about, encouraging kids to bring a water bottle to school that they can refill versus going to putting their mouth on the water fountain. Little things like that. That may be able to things, wiping down the doorknobs frequently, keyboards, etc. Like I said, anytime you can go outside, take those kids outside. Let them take that mask off. Spread out and take the mask off. Hand hygiene, we can't talk about that enough. This is stuff that we talk about all the time as nurses. There is a little recipe for making a bleach solution that will be acceptable for COVID-19. That's on our that's in the document as well. And we'll go on down. Talked about surfaces, water fountains, custodians. We're encouraging everybody to wear proper PPE. Very important that when you're going outside, if they're using playground equipment, to wash hands before they go and after they get back, or hand sanitizer at least before you go, and then come back and use hand washing when you come back. Try to minimize, if possible, how many students are in an area at once so they won't have to wear a mask. Cafeteria staff, they are having their own training on serving food, what can be served. We you can use your cafeteria. Students are wearing a mask as they move and go through line. We have recommended possibly putting like a plexiglass shield, sneeze shield, like you see in fast food restaurants or whatnot, that the cashier would sit behind. Because we want kids to still be able to get hot meals if at all possible. They will be doing extra cleaning, but we want the cafeteria to be, you can't have 100 kids in there like you used to. If you want kids to eat in the cafeteria, kids are going to need to sit 6 feet apart. And if they sit 6 feet apart, of course, they can take their mask off to eat. Then when they get up from the table, they'll need to put their mask back on before going back to the classroom, and wash hands, of course, when they get back. It's very important that teachers keep manifests. We need to have assigned seats. We need to, for classrooms, for buses, for the cafeteria, so we know if little Angie gets COVID-19, the contact tracer, we can give them that manifest of who they sat near in the cafeteria, who they sat near in the classroom, and who they sat near on the bus. And then they will be able to determine who needs to go into quarantine. If it was a student who sat on one entirely different side of the cafeteria, the students on the other side very possibly may not have to quarantine. It may just be the students that sat at their table. So very important that we keep accurate records. And I know teachers like to move kids around constantly, and this isn't the time to do it if you can avoid it. I know sometimes you don't have a choice, and you have to because of behavior or whatnot. Just make sure that you, if you do move the kids, you make a new manifest and date it, what date it became effective and whatnot. That way they, we've got to have good record keeping. Class for teachers and students in class with deaf students. Yes, there are masks that are available now that have cloth masks that have a clear, like vinyl section in the middle that you can wear to that they can still read lips. In the absolute event, they still want you to, they really don't want people wearing face shields without a mask because they're just not effective. But as a worst case scenario, I would at least encourage them to wear a face shield. And let's see. Food service, disposable food items, materials, use paper plates when you can, things that they kind of do already as much as possible, maybe some sack lunches here and there, but they're receiving all their training on that. Okay. Gyms and weight rooms and that sort of thing, there is going to be specific guidance coming out soon on the use of those, with the weight rooms and how they need to be disinfected. And that's all coming through the Kentucky High School Athletic Association. So that will be coming out within the next week or so. We'll roll that down. We're talking about hand washing still. That's a nice little hand washing poster that you could use in your schools. Okay, contact tracing. We've spoken a little bit about this earlier, but this is why I encourage everyone to document an Infinite Campus as much as possible, because it will make it much easier for you to keep up with this information. You'll be able to run reports to quickly see who had the positive screenings, any documentation that you may get from the contact tracers, you'll be able to scan and upload into documents into Infinite Campus. So these are very important things to have. Also, the manifests. The school nurse is not going to be responsible for keeping the manifests of the seating arrangement in the classroom and the seating arrangement in the cafeteria or whatnot. The only thing you may be asked to do is help gather that information, provide any underlying health information that they might need, just to help facilitate the process. You will not be asked to do the contact tracing. That's all going to fall under the health department's contact tracer. So take a big deep breath. That won't be asked of you. We'll go on down. And that is kind of it in a nutshell. Dr. Meserly is not on here yet, but our Associate Commissioner, Robin Kenny, is, I see, has hopped on. And I know she has a very special announcement regarding some thermal thermometers, infrared thermometers, that I think she would like to share with you. And I'm going to open the floor up to her, and if there's anything else she'd like to talk about at the moment.
Thank you, Angie, and good morning. I'm sorry that I'm joining a little bit late. First of all, let me echo and thank all the school nurses and district health coordinators for all that you're doing. You're going to be a really important piece of guidance, information, and support for your local school districts. We continue to encourage your superintendents and your districts to make sure that you are included in the discussions about reopening of schools. So if they are not reaching out to you, do not be shy, as I'm sure many of you are not. Make sure you insert yourself into those conversations and offer the valued experience and education that you have behind you. So please make sure that you're participating in these discussions. I do have an exciting piece of news, and I was hopeful that Angie had already shared it, because you didn't need to wait for me to celebrate on this one, but we have been in conversations with the Department for Public Health, the Kentucky Emergency Management, as well as the Kentucky Transportation Cabinet, because it really does take all of us working together to really assist in your efforts of reopening. And earlier this week, we were notified through that partnership with other state agencies and organizations that they will be providing more than 12,500 of those no-touch thermometers to school districts. We're going to loosely base our distribution upon how many school buildings and how many school buses you have. So that's going to help us just with the allocation and coming up with the numbers that you will receive. They will be distributed through regional locations that will be identified through the Department for Public Health. So we will get that information to you as soon as we know the exact counts and where your district can pick them up. But that's very, very exciting news. I know many of you have been very concerned about PPE in general and how to get those thermometers. Once they are distributed to you, it'll be up to your district to decide how to distribute that across your district. So this will be an allocation method on how many you get, and then your district will decide where to place those. The other thing that I just want to share with you, that we are continuing to have more detailed conversations with emergency management and the application of FEMA relief. PPE is one of those eligible expenses we believe that can be recouped through FEMA dollars. So we are continue to talk with your finance officers, your superintendents, and what that will look like, as well as explore options for access of other PPE. We're hearing some questions, and I even see one in the Q&A about recommendations for masks for teachers and students in classes with deaf students. And we do have the Kentucky School for the Deaf as part of the Kentucky Department of Education, and I know they're looking into purchasing those types of masks. As soon as we get a little further on that, I'll be happy to share that, as well as any state master agreements that may be available that you all can access, your district can access for purchase of those supplies. So some good news about your thermometers that will be coming your way. And we do understand this is not going to take care of all your thermometer needs or all your PPE needs, but we do appreciate the partnership of Public Health, EMS, and KYTC to kind of get us started. With that, I think I'll turn it back to Angie, and am very happy and continue to appreciate all the good work you're doing.
Thank you. Let's see. I'm getting a message from Dr. Meserly. Let me bear with me while I see what it is. Apologize. Okay, she says she can't get on the call until 11:30. Okay, well, we will do our best to answer what questions that we have so far. And if it's something that I do not know the answer for, we can wait for her when she comes on, or we can always have her answer. You can submit those and we can have her answer those, and we can distribute those answers to you. So no worries. So let's look at some of the questions. I'm going to look at some of the questions first that were submitted from our Google form. Will we need to document each child and staff member's name and a temp on a form log? Do we need to ask health screening question? Okay, I think we've already talked about that, but no, you will only need to document if they are positive, if they have a fever, or if they report any of those symptoms. That would need to be documented, preferably in Infinite Campus, so it can be tracked. But now it's going to be too cumbersome for you guys to fill out logs on every student that walks in the door. Staff can do their own screening, and there's a form that's in our companion piece that comes out next week that's similar to what we use here at the state level, that you fill out yourself, you complete, it checks, don't have these symptoms, and check your temperature, and that's it. You can do that. But as far as documentation and keeping them, you only really have to keep the positive ones. How will nurses supervise the isolation room, as well as do other things? We've talked about that. I would really start talking to my building administrator, and we've been stressing this with superintendents all along, that you really need to consider having a separate space that is supervised for the isolation of sick students. We also talked about the possibility of maybe having an unlicensed staff member that's trained in medication administration, that the kids all report to do their daily meds, or in your diabetic provider possibly do your diabetic students. So at least that core group of kids are not going to walk into the nurse's office and get exposed. That could be a viable option if you don't have any other options. About a Google form that parents or that students could complete every day. We are not asking students to complete a daily health assessment. That will fall under the parents' thing that they will sign, saying that they will not knowingly send their child to school with symptoms, and then all you will have to do is screen their temperature when they get to the school property. What strategy should we implement if a child has a fever at the door? A holding room? Yes, I would either, if it's a bus rider student, yes, when they get off the bus, if they've screened positive for a fever, then you should have I'm sorry, got distracted. You should have a plan in place for what you do if you have that event. More than likely, they would need to come to the nurse to be assessed. So that would be the thing that I would recommend doing. If it's a car rider line student, you check them right there before the parent pulls off, and if they've got a fever, they're back in the car, and then they've never even entered the school building. So that would be my best recommendation, that you've kind of nipped that one in the bud. Okay, let's see, next question. In the Team Kentucky guidance, says staff who administer a Haler have to wear PPE. That's correct, they should wear PPE, but self-administering students will not have to. I would ask them not to do it in a classroom full of students, just because of the possible air particles that's going through the air. But I would isolate them if possible to do that, or let them step outside the classroom door or somewhere. But yes, don't do it in a crowd of people. Good question. They've contacted Public Health Legal about employees should check temperatures at home before coming to work, but the Healthy at School document says they should do temperature check for all staff at point of entry. Who should we take guidance from? Robin, do you have any idea about that one, or should we pass that on to Dr. Meserly?
Yeah, I think we can follow up on that one and see if it's acceptable under this kind of, employees of the Commonwealth. We can check our temperatures before we come to the school, before we come to work. So we'll just need to get some clarity from public health if that is an alternate but acceptable way to perform it.
Okay, thank you. All right, let's see. Down the next here. Are there criteria that must be met to be considered medically exempt? No, we first discussed that, and we decided that if we came up with a list, we would guarantee there would be something pop up that was very credible that we hadn't thought of. So therefore, that we left it up to the physician to make that decision, or the ARC as part of their IEP. If the healthcare provider signs off, or the ARC team signs off, then that's acceptable. And you don't have to have a specific form. The doctor can just write something on a prescription pad. It just needs to be provided to the school. If that's a special needs student, special ed would need to share that with the school nurse, and vice versa. If the nurse got the form, they would need to share with special ed as well. Theories on COVID testing in schools. Unless you have a school-based health clinic with a healthcare provider, a nurse practitioner, whatnot, we don't recommend doing those in schools. One, it's very invasive. It's probably not something that most parents are going to want to have done without them being there. Plus, the aerosolation of possible COVID-19 from doing that could spread it in the air there at the school. So the school nurse should assess the student and make referrals as needed to the health department or the pediatrician. Remember, we cannot diagnose. That's not in our scope of practice as a registered nurse. So we need to get them out of the building and hooked up with medical care as quickly as possible. Let's see. Can start return to school when the healthcare provider provides clearance documentation for the school record. Yes, and also, but if they are being contact traced, that contact tracer will need to release them as well. If they are being seen, if they've been seen for strep, pink eye, something like that, then definitely you want to take the doctor's word from it. But you definitely need approval from that contact tracer in the health department for students to return, or staff to return back to work. How long should a student remain from school if their only symptom is a fever and they haven't had exposure to COVID? Right now, the CDC is saying 72 hours fever-free for without any type of fever-reducing medication. Normally, we go by the 24. They're delivering. Oh, the school bus is delivering meals in my neighborhood. That's awesome. That we do 24 hours, but given COVID, they've changed that to 72 hours. And when Dr. Meserly hops on, we can ask her about that, but I know that's what the CDC is currently recommending. Past years, parents have come to the nurse's office to drop off meds, fill out permission forms, etc. Is it acceptable to have secretary take the medicine from the parent to decrease number of people entering the building? Yes, as long as that medication is being counted by the parent and a staff member, and that they both sign off that they agree that's the number of pills or ounces of medication that was submitted, then that is perfectly acceptable. And then you can document that in your medication administration log or your Infinite Campus under medications, that it was counted by the parent and the secretary and provide their name. So that's perfectly acceptable. Okay, and it seems like there was something about questions regarding preschool and kindergarten. There is guidance coming out within the next week or so that we'll be addressing special needs students and preschool. I think that's scheduled to come out the middle of August. You know, they're not required to wear masks, but they are asked to try to socially distance the students as much as possible. But more specific details will be in that KDE companion piece that'll be out later this month. So just keep your eye out for that. Okay. Samantha, are there any other questions that I have not seen?
Probably you kind of jumped around in some of the questions, so I've been trying to keep up, but there probably are, but
let's see.
We'll have to go back through those.
If students are being assessed at by the bus monitor prior to loading the bus, should they be reassessed again at unload? As for Dr. White yesterday, she was recommending that they be checked again when they get off the bus, because some of our students may ride the bus up to an hour and could spike a fever while they're on the bus. So her recommendation was to do a quick check as they get off the bus as well. When do we foresee school starting back? Now that is a district decision. We leave that up to each individual district to decide when they're going to do that. We've encouraged them to do surveys to parents. And I think we are going to be conducting a survey through here at KDE, just asking superintendents to let us know when they're starting, because other districts are kind of asking too. Are more people starting early or more people starting late, or whatnot?
Hey, Angie, this is Robin. Can we go back to the question about taking the temperature both upon getting on the bus and then getting off the bus?
Yes.
I do think that, as Dr. White talked about that, you know, that's another one of those lists of mitigation strategies to reduce the risk. However, my understanding is the expectations of public health, which are those things you have to do, are you have to have either the parent attestation that they're not going to send a kid to school with the fever and symptoms, but then you can let them on the bus. And if you're not taking the temperature either in person as a student is boarding or on the bus, then when they get to school, they have to have their temperature taken. However, if they take the temperature of the child through a bus monitor, I don't think they are required to take that temperature again upon school property. And in fact, you could then, if you did all the kids on that bus, they could go through a different entrance to your facility, possibly. Of course, this is your local district's decision, how they logistically get those kids into the school, but they would not have to repeat the taking of the temperature. So I think Dr. White was really talking in terms of that would be another step that would help mitigate the risk. And of course,
an ideal situation.
Anything about mitigation of risk is highly, we acknowledge, and that's really good. But I don't think it's an expectation under the public health document that they have to do it, both on the bus and getting off the bus going into the building. I don't know if that helps.
Yes, I think so. Guidance needs to come out earlier than the middle of August for special needs students. Now that it's supposed to come out the middle of July. So I think week after next. Is that correct, Robin?
I do believe that's right. I think maybe we just misspoke earlier and said the middle of August.
If I said August, I meant July. I'm sorry.
Yeah.
Sorry about that, guys.
We don't have a real good sense of time anymore, do we?
No. I didn't realize that it was 4th of July week till like yesterday. So, so just bear with me. I'm old and homebound at this point. Let's see. We'll scroll through some of these questions. Bus. Why is an inhaler risky for spread of virus since aerosolization is when you inhale the medication? This is just what the CDC is currently recommending for any type of inhaled medication, whether it be a aerosol via a nebulizer or a inhaler with a spacer. So that's why that was put in that guidance by public health, because that's currently a CDC recommendation. If that changes, of course, just like anything in this document, we consider it a living document. So if the science and the literature changes, then we will make adjustments accordingly, and of course make sure you guys are aware of that. But that's, I know, the rationale for the PPE and stuff for giving neb treatments and inhalers. What about nurses who are possibly exposed? Will they have to quarantine as well, even if they're wearing proper PPE? That's up for the contact tracer to decide, but there is a very realistic possibility that a school nurse will have to go into quarantine, because you've probably spent the more in-depth close-up time with that student than anyone. They may decide that they didn't spend that much time with you given the level of what PPE you're wearing, but that's truly going to be the decision of the health department and the contact tracer. So don't be surprised if it happens. Are the requirements for the Kentucky Department of Health applicable to private schools? Robin, they're not required by our stuff, but I'm not sure about, I would assume they have to follow public health.
I don't know the direct answer to that. I will share that we have been inviting some groups of private schools to participate in the conversations about reopening, not mandating them to, but there has been expression of interest by some of our private schools, just from an awareness and information sharing standpoint. So we're happy to have those private schools participate. I would think just under local health policies, taking it outside of the educational setting. Of course, local health policies apply to all. So I'm sure there are lots of things, even operating a private school, that the emergency orders of the governor, as well as instructions and directions that are coming out of public health, do apply. If there's something in particular that someone's interested in, if you can send us that specific question about whether you think something applies or doesn't, and we'll try to run that down through public health.
Thank you. What are recommendations for parents that just don't want their child with no medical conditions to wear a mask? Can those students just not wear a mask and attend? I think that's going to fall into a district level decision on how they want to handle those students. Robin, if I'm wrong, please feel free to speak up. But I really think, we want to encourage everyone to, you could offer them an alternative learning model, possibly, if they would rather do a virtual or, home-based program. But I think districts should just try to get parents to do it, but I understand there's going to be some out there that probably will refuse to wear a mask.
I think, Angie, this is Robin again. I think the way Commissioner Brown has spoken about this issue is really good, how he's explained it. I think what we are experiencing as communities, as a state, and really as a nation, it's a culture shift. And culture shifts sometimes take longer to really sink into people. He compares it to, we have rules and regulations and health policies about wearing shoes to school, and probably at one time, a long time ago, people didn't want to wear shoes to school either. But as time has evolved, that's become a more accepted practice, and so people do it. I said, unfortunately, as we've all observed, we have members of our population that do not feel the same need to comply with the wearing of masks for various reasons. And so it's going to be really difficult. It's going to be a challenging situation for school districts really to have that ideal circumstance where everyone just appears at your door with a mask and ready to learn. I mean, it's just going to be really challenging. I think what we are recommending and prefer, of course, is to model that behavior. So certainly have all the adults in your school district modeling the behavior that we want students to then comply with. You know, I have a daughter that's going to be a first grade teacher this year, and it's her very first year. And she's wrestling with that, Mom, how am I going to have all these first graders wear masks? How am I going to make it so that they want to come to school and wear a mask? And for that age group of kids, you may have to turn it into games or, you know, stories or presentations about the benefits. Because at the end of the day, the reason that we're asking people to wear masks is really so that we can continue to have school and so that we can continue to protect our staff and our students. So I think we're preferring that we continue to have those conversations about the benefits of doing it. Our general counsel, Todd Allen, weighed in yesterday because it's a question on superintendent's minds as well about what happens if somebody just says, I'm not going to. We prefer that encouragement, education, modeling opportunity. However, at the end of the day, and we would see this as a last resort, you know, after you exhaust all those methods and you still have something, it really is a local district decision on what you do next. And that could include some type of disciplinary action, but we are certainly not encouraging that. We would hope that you could get there a different way. So it's going to be a tough one, and it is a good question because your schools and your communities need to be thinking about it now.
Thank you. Someone asked, does telehealth work for assessment of non-emergencies if you are in multiple schools? If you have a secure connection, yes, that is a very viable option. I know as school nurses, we kind of triage things over the phone all the time that we couldn't see. So this is just an added layer to make your job a little easier. So yes, that would be acceptable. I would just document that you perform that assessment via telehealth and how you did it, but just for documentation purposes. Let's see, Safest School document mentions something about medication administration in the classroom. That is an option if you have a student who takes a daily medication and you want to minimize, you know, their time in the hall or possibly getting exposed in the nurse's office. If that teacher is willing to do so, as long as the medication is in a locked cabinet and the classroom is locked, when people aren't in there and they are trained in medication administration and you feel confident, then yes, that it's something that you could do to, you know, mitigate possible exposure. How long do we keep forms for staff with positive health screenings or fever? Should they be kept in the nurse's office? Ideally, I would scan them and upload them into documents into Infinite Campus. You can do that for both staff and students. Then you don't have to keep a paper copy of anything. And storage is always a big issue for schools. The less paper you have to deal with, the better. Then that way, if you are contacted by the contact tracer, you can just print it straight out of Infinite Campus. Let's see. Thermometers that are being provided, is it only for public schools or will be available for private schools as well? I am not sure. And I think Robin has hopped off. So I will have to find out about that. And we'll put that in our Q&A and we'll let everyone know. But that is a very good question. Someone's posted that they have found quality clear masks and they're totally clear and they ordered them from Oak Tree Products. Oh, let's see. If a student has a cough with no other symptoms, do they need to be sent home? If you think that it's allergy or asthma related, then no, I would monitor that student closely, of course, and then you could go from there, because we're living in the allergy belt here, here in Kentucky. So, not necessarily would you have to send them home for a cough, unless you had concerns about that cough for sure. In that companion piece, the Allergy and Asthma Association has developed a wonderful little flow sheet on, is it asthma versus is it COVID? And I think you could use it even toward allergy type symptoms as well. And you can get that off their webpage. It's on there now, or the link to it is in that document that'll be out next Tuesday. So I would recommend printing that out and putting that in your nurse's offices. What if a kid's sent home with COVID symptoms, but parent does not take them to the doctor? When are they allowed to come back to school? That will let Dr. Meserly answer when she hops on. But there is definitely parameters by the CDC that has set forth on how many days they have to be symptom-free and fever-free before returning to school. So we'll get back. We'll have her speak to that. Hopefully she'll be on here soon.
Angie, there was a question about siblings. If a sibling has COVID, do siblings need to be sent home, or what's the guidance on that?
Yes, and that contact tracer will. Well, that's maybe another thing they're going to ask is, do you have any other siblings in the school? And but yes, they would need to go home as well, and then they'll have to follow the guidelines set forth by their contact tracer. Our district's always used 100 as exclusion. Can we stick with that? Yes. Whatever your district policy is, you do not need to change it to make it, you're just being more proactive. So, no, that's fine. You don't have to change that.
There's a question about confidentiality when if you're giving medication to a student in a classroom or in the hallway. What's the?
Well, and that could be, and that's the thing. You may want to go into most classrooms have a storage closet. You could do it that way. I would just, if you're doing it out in the hallway, I'd make sure no one's out there, and just don't make a big deal in front of the class. Johnny, we're going to go take your medicine, blah, blah, blah. You could just call Johnny, go to the door and call Johnny outside. Just be as discreet as possible. Just kind of like you do when you call a kid out to do a head check. You don't make it obvious, and we'll go from there. Will we be sharing the PowerPoint? Yes. And that will be, we'll put that on our webpage as soon as we get it ADA compliant, and it will be included in the video too that's going to be posted as well. Any other things I'm missing, Sam?
People are wondering how how districts apply to receive the thermometers.
Okay, you will not have to apply. KDE has provided the Department of Public Health a list of all the schools in all the public schools in the state, and our transportation department is giving them numbers of buses. So that helps determine, they'll use that formula somehow to determine how many each district gets. Then your superintendent will be notified as to where to pick them up and whatnot. So this was announced to superintendents yesterday on the superintendent's webcast. So they're aware this is coming. So if you don't hear anything in a week or so, ask your superintendent, and if I hear they're being released or whatnot, I'll send something on the listserv. That way you can make sure you get with your superintendents and go from there, or your DPP or whoever's going to distribute them for their state. Somebody asked, "Is there new guidelines for workplace health and safety?" Yes, it is. The safety is going to be released on July 6th. I'll see what day of the week is that. Is that Tuesday? I don't have my calendar here in front of me. Let's see. We tend to roll things out, if possible. Yeah, Monday, the 6th. We'll also be discussing it on Tuesday in great detail on the superintendent's webcast. And you can watch that on the KDE media portal online. If anyone, that's open to anyone to watch. It goes through a YouTube channel. So if you want to see that when it's announced on Tuesday at 2 on the superintendent's webcast, you can watch that as well. I'm asking about the October 15th. We are not waiving that requirement for the October 15th for physicals or immunization. There will be no penalty to the school if it's not turned in by October 15th. But we are encouraging parents to make every effort to try to get them turned in a timely manner. And especially if kids are behind on shots, we want to try to do our best to get them on a catch-up schedule before they come back to school. Middle and high school students who are multiple classrooms, how do you determine if one's positive? If you have one positive who have been in several classes, that is going to be up to the contact tracers. So that's very important that they keep that manifest and class lists, because if they're changing classes every hour, that contact tracer is going to need to know who's in that classroom and who sits where. And then they'll determine who out of that bunch will need to possibly go into isolation. Will nurses be required to wear face shields or goggles as wear a surgical mask? Yes, I would encourage you to do so. About fit testing, if you have the luxury that you can do fit testing for N95s, that's just one more added layer of protection. But I know a lot of that's not an option for a lot of people, so that's why we're recommending at least the face shields and the full PPE gear. So you do the best you can.
Angie, it looks like Dr. Messerly is here now.
Oh, awesome.
Can you guys hear me?
Yes.
Oh, great.
Yes.
Okay. All right. Sorry, I literally had 3 calls scheduled between 10 and 11, and the first one I had to present. So, all right. How many school nurses and district health coordinators do we have listening in today? Do you know?
Josh, do you have that number by any chance?
I'm showing 103 in attendance.
103.
Okay. And we do have a combination of district health coordinators and school nurses, correct?
Yes.
Okay, great.
Yes, that's correct.
So I'll introduce myself quickly, briefly, and then I will help Angie answer some of these questions, potentially if she was unable to or at a different level. I'm Emily Messerly. I'm actually a former school nurse. I'm a nurse practitioner now. I practice at Baby Health Clinic, and I also am the new immunization branch manager for Kentucky. And I've worked with Angie and her team at KDE on developing this back to school, healthy at school guidance. So, and we could have provided you with a 96-page document instead of 24, but there's only so much you can fit in. So I'm grateful to KDE for taking our document and then providing some more detailed guidance, like the school buses and KMEA is doing the band. I have a question because I've been getting questions from health departments. Do you all know if the physical education group is going to come up with a more detailed guidance for their group? Have you heard that, Angie?
I have not heard.
Okay.
But that's a good question. So I will do some inquiring about that.
I think
I would
that
assume so, but
yeah, I
don't
think
want to
that
speak out of
just
turn.
like if we're doing it for bands and we're doing it for pupil transportation, I think, you know, physical education is a really specific activity at school that probably needs to be addressed by that group who does it, you know, come up with their own guidelines so that everybody's not kind of asking all the same questions all over the place. I think that would be great.
Yeah, I agree.
So tell me, Angie, and thank you for doing this presentation today. Tell me what, and by the way, I forgot to say, I'm also a parent of 3 public school children who ride the big yellow bus to school, 2 high schoolers and 1 middle schooler. So I've been public school, Fayette County all the way. So I'm coming at this from a parent and a nurse perspective. Tell me, Angie, if there were questions that were high on the list or repeated, or questions that you couldn't quite
Okay, one
answer.
of the big ones, let me get to it. Okay, a nurse had contacted the Healthy at Work email service through CHFS.
Yep.
And they stated that employees could do self-check temperatures and screenings at home before coming to work. However, this guidance document says a temperature check for all staff at point of entry to the school. So they're just wanting some clarification on if a home screening is acceptable, or will it have to be done at school for staff?
So I'm actually surprised that it's worded that way. I mean, if you're going to mirror what we are doing here at KDPH, I don't know how you all are doing at KDE, but here at the Kentucky Department for Public Health, we have a 2-week log that we fill out with our symptoms, but we don't list our temperature because that's like HIPAA, but we turn in kind of a self-report log, and then we also check our own temperature and put it just a check mark that we've checked it. But we I don't think that we honestly meant to say that teachers had to be checked upon coming in the building.
Okay,
I
so
think
as
because
long as they do an assessment somewhere,
right, a self-assessment. Because if you look at if you look at the Healthy at Work guidelines, those teachers shouldn't be treated any differently than that. So
right,
yeah.
Okay, let me see. Sam, can you think of off the top of your head while I'm looking through this document, are there anything for Dr. Meserly? I know we had a couple.
I'm trying to think also. Hold on.
I can see the chat and the questions. So I was gonna scroll up. I did see that somebody had asked about face shields and it's been a big conversation back and forth between all parties, and face shields are not a replacement for a face mask. They can be in addition to a mask, but they're not a replacement.
Okay, and I think we had someone ask if it was a staff member who, due to physical medical conditions, could not wear a mask. Would a face shield be an option? I know you wouldn't get the same level of protection,
right?
But
right. So the key for me, the key point that I want to drive home is that, and this is based on all kinds of guidance, that if you have a staff member who has a chronic condition, they're immunosuppressed, they are elderly, your school district needs to think about accommodations for that teacher, especially for giving them the option to teach remotely if possible. So because really in the school setting, more than the children, we're actually really looking more at protecting the adults. The children are the carriers, but the adults in the building are who we're really looking at protecting. So that staff member would have to work with their physician to see if they needed a special accommodation to work from home. But that's definitely in all the CDC guidance, that we need to make sure that those immunocompromised or chronic condition adults in the school setting or bus drivers, that we really need to take special care of those populations.
Yep. Okay, here's one. We were saying 72 hours fever free before returning to school, just for symptoms and fever. That's with any symptoms, not necessarily COVID, correct? Okay.
Right.
Just want to clarify that. Okay, if a staff member is sent home to quarantine due to exposure, is it likely that their children who go to the school will be put in quarantine as well?
That would be, that's all related to contact tracing. So as long as the guidelines are followed, and I heard you, I hopped on before and then had to hop off, but I did hear you say, Angie, about keeping, doing roll calls, seating charts, anything that can be done to maximize contact tracing will minimize the students who have to be excluded. Sometimes classrooms or partial classrooms might need to be excluded, but if we are doing a good job of keeping track of who's when and where, then it's very unlikely that like a whole school closure has to happen.
Right. Okay. Does the school nurse contact the health department or contact tracer? Well, the contact tracer, I think, will be the one that will contact the school. Is the way I understand it.
So,
yes.
So what will happen is if a staff member or a student tests positive, that comes from their provider. So then their provider notifies the health department. Then the health department will contact the school. That's the sequence of events.
Okay, and we've had someone asked, and I know these are CDC guidelines, I know, but asked you to describe the rationale for wearing PPE when administering a inhaler versus a nebulizer.
So we in the guidelines, we cut and pasted that directly from the CDC guidelines, and one of the things that they state is, and I've worked in the school setting, utilizing a metered dose inhaler, the small one, is much more preferable to doing the actual aerosolized Ventolin treatment because of exposure and the PPE needed. So as much as you can just use the MDIs in school.
Okay, if students sent home with COVID symptoms, but a parent refuses to take them to the doctor, when would they be allowed to go back to school? And if they have siblings, do the siblings need to go home and have as well?
That would be up to the provider and the contact tracer. Yeah.
And if the if they're not going to the doctor, though, if the parents refusing to take them to be tested, I guess they're asking when they can come back to school if they're having symptoms, because the contact tracer wouldn't know about symptoms.
Right. That's going to be on a case-by-case basis at the schools. I know that that's happening already. I have friends who are pediatricians, and they're recommending that people get tested, and then they're not. So then you have to go.
Is it 14 days? Best practice, is that what you would consider?
If they've been exposed.
Yeah, but if they've not and they have symptoms.
If they've not, then 72 hours without fever.
Okay.
Because you don't know if they have COVID or not.
Correct.
So, yeah.
Correct. Okay. Let's see. You're free for.
I have to say sometimes to people, like, sometimes you have to put on your pre-COVID hat.
Yes.
I
said we're still going to have kids with just the pukes. We're still going to have kids with diarrhea and pink eye.
Exactly.
So you can't always assume everybody's going to have COVID.
Right.
So,
you sometimes have to think like, hey, what would I have done last year?
Yes.
And then absolutely.
And that's going to be hard for teachers to think about because they're going to assume everybody's got it. So it goes back into trying your best to reassure teachers. Here's one. We have a private school asking if the Department of Health requirement, this document is applicable to private schools?
Absolutely. It's not a regulation or a statute. It is best practices. It's guidance. It was put out between KDPH and KDE. So if private schools normally look to KDE for guidance, then yes, they can use that this guidance as best practice.
And they do have to follow public health guidelines as far as immunizations and that sort of thing anyway.
Absolutely.
Correct?
Absolutely, because they still report to us every December 31st on their immunizations. So yes.
Okay. Let's see, Sam, do you see anything we've missed?
There was one about, I'm trying to find it now, about HIPAA. Regarding HIPAA, who is allowed to take temperatures of students before they enter school?
Who is allowed? Well, we're not, one of the things that's not being done is we are not recommending that anybody records the number, just a checkbox that their temperature was taken.
If they have a fever, they just send them to the nurse for assessment.
Right.
Yeah.
Right. And those forehead scanners, thermal scanners that Commissioner Kinney, that Robin Kinney was speaking about, that our preparedness department is giving to the schools, there would probably need to be a small, train the trainer on the forehead scanners, but I don't think it's a delegation kind of thing like medication.
No, it's not.
Nah, yeah, right.
And now once they sent that student to the nurse to assess, then you could document the temperature and any symptoms, and in that.
Right, because then they're in a healthcare.
All they just need to do is Johnny's got a fever, and they're going to say go see the nurse.
Right.
Or wherever they're supposed to go if they have a fever for your building. So, yeah, because it says it's going to take too much time to have to document on every person when it's non-remarkable.
Absolutely. No. Yeah. No. You chart by exception.
Yep.
Yep.
Okay. Anything else, Sam?
There was a question, let me see. It says, we have a doctor that frequently writes waivers and excuses for students. Is there an acceptable set of reasons why students should be exempt from wearing a mask? Will the doctor have to list the reason for exemption?
That's a good question. I do know that our Dr. Purcell, who is our cabinet for children with special health care needs, came up with some guidance for masks with children with special health care needs. And my best answer to that would be that it should be addressed in an IEP or a 504, not just a random doctor's note, that it's a true IEP 504 kind of statement, so that those children with special health care needs that have a sensory issue with wearing a mask can be addressed appropriately. Do you agree, Angie?
Yes. And if it's an so your typical student maybe that has severe asthma and can't wear it, then I would think at least I would get something from the doctor, but I think the nurse could address it in the IHP for that student as well.
Yeah, the IHP, not IEP.
Yes, IHP.
Yeah,
the healthcare plan for that student versus and you're going to know who the kids are in your buildings that truly can't wear a mask. It's going to be pretty obvious who those kids are. But that just gives you an extra level of protection if you include it in the IEP or the IHP.
There was a question about religious exemptions. So I haven't heard anything about that. What is the guidance on that, or
for immunizations?
Probably for wearing a mask, or for kids who aren't immunized. I think it's probably mostly about masks.
We don't have any, there's no guidance on that.
I'm not aware of anything for religious purposes about wearing a mask. I think that would have to be a case by case decision.
I know I just filled out a survey for Fayette County that Manny Cox sent out for my middle schooler, and they listed the 3 options. First of all, are you going to send your kid to school? Would you rather them be at home? So as long as your districts are doing, due diligence and getting feedback from the families, accommodations can be made.
Anything else? And we're getting close to the top of the hour.
Yep.
I don't see anything else right now.
Okay. If there is anything that we have not answered, please feel free to email myself or Samantha, and we will, if we can answer those questions, we will. If not, we'll get them to Dr. Meserly for her response. We appreciate you all being on here today.
Angie,
2 hours is a long time. I'm sorry. Go ahead.
Sorry, don't want to interrupt, but someone just asked if what if parents say they do not want their child's temperature taken because they don't believe the virus is real? So.
Well, don't know how to answer that one.
I don't either. I think that's going to kind of fall under the same thing about the masks. It's just going to be an expectation for going to school. Just like
and that family, that family may be given the option of NTI. I don't know. It's going to happen.
Yeah,
it's going to happen, and districts are going to have to come up with,
decide how they're going to deal with it. Really,
decide how they're going to deal with it. Exactly.
It's going to be like wearing a mask. What if we know there's going to be families that are going to refuse to do it? So, encouraging them to do it, provide the guidance, the science behind it, and give them options is really the best thing you can do. I'm just saying here, Shape America Society for Health and Physical Education has released school guidance for classes and school consideration. It's a very comprehensive document, and we encourage you to share this with school leadership and PE teachers especially. So I will get that link. I'll send that link out today on the listserv, and I will see adding that link to our companion piece that comes out next week as well. Thank you, Jim Tackett.
Angie, there was a question about taking daily attendance for staff for contact tracing. I'm not sure. It was just asked in the, should daily attendance be kept for all school staff for contact tracing purposes if they are doing screenings at home?
Rhonda, are you on there?
I think staff attendance is just as important, if not more important than student attendance, honestly.
Okay.
Yeah. Do they track staff attendance in campus?
I don't think so, Josh. We didn't where I went.
Hey, Angie, it's Josh.
Yes.
No, we do not recommend doing staff attendance in Infinite Campus.
Okay. So somebody will just need to, I guess, keep a log of if staff's out.
Where does staff record their time? Is it an online system?
Well, they would do a time. Most of them do time, or they did back in the day when I was in a district. You did time sheets. Teachers did a sign in and out sheet, something like to that order. I'm not sure.
Actually,
I'm sure it differs.
Is it an online system?
They just kept track of it at our district office, and we were under a contract. So if we called in for a sub, we had to call in, and then they would provide the sub, and I'm sure at that time would mark down if we weren't there. But again, I think that would be a district way they could all do it differently.
Yeah.
It makes sense to me to for contact tracing purposes to whatever county it's in, have that county, get the sub list, or who requested a sub, and then they know who's absent. So yeah.
And it may be that they just, whoever the district or building contact person is for getting subs, just provides a log of what days Teacher Brown was out. That may be the best way to do it. I don't know, but I think that's going to differ district by district as well. Okay, well, I'm going to try my best to be respectful of your time. Like I said, we'll feel free to email any questions that you have. I appreciate you all taking the time out of your busy schedules, and I hope this has answered some of your questions and maybe lessened your fears just a little bit about what to expect and what's coming down the pike. Our guidance second piece will be out on Monday. And we are an email or a phone call away if you have questions. I read that 2020 was named the year of the school nurse, and how in the
Woohoo.
world did anybody know, that how true that was going to be this year? So
Yep.
thank you all for all you're doing and for loving those babies and taking good care of them, and take good care of yourself. Try to do some self-care what time you have left before you go back to school, because these kids are going to need you more than ever this year. And we're going to be right here cheering you on. So until next time, we will see you soon. Thank you very much for helping. Thank you, Dr. Mazzarelli.
Thank you, Angie. Thank you. Bye-bye.